The federal government, through the Ministry of Health, has begun a review of the 2019 National Health Management Information System to improve planning and decision-making in the nation's health sector. The review, which was done in partnership with international non-governmental organizations, was held in Abuja. Participants at the event say the process would help the ministry identify loopholes and challenges in the system, incorporate new data elements, and remove redundant data that might hinder accurate and timely data collection and reporting on health matters.
We know that there are lots of things that change, new infections come in, new diseases, new things come up. And so it only makes sense for an organization to keep reviewing its processes to be in tandem with what is available or acceptable globally. So for us as Plan International Nigeria, ours is just to support because we understand the importance of data and adequate data capturing to the work that we do. Who knows the impact of the 100 girls that are about to be married off in Niger State? What can we say about the state of the girls in a particular location in Nigeria? We don't have those up-to-date data, and for us that is something that's very important because harmful social norms hide and thrive when we don't have enough data to back it up. We have been talking about issues that have to do with girl-child marriage. So far, we find out that in Nigeria, globally, in Nigeria is like the third, we have the third highest number of child bride. And you know, for children that are married early, issues of obstetric fistula, VVF, and all of those things. We are also perpetuating intergenerational poverty. And so these are things that we need data to be able to tell government that, look, this is what happens when you marry off young children. This is what happens when girls don't have education. And so for us, it's not yet there, but the Federal Ministry of Health is really trying, and this is one of those times that they're trying, looking at how to keep reviewing their data to be up to speed.
To ensure that we have the current tools that can help us to gather relevant data that can be used holistically to take decisions in the health sector. There is a current drive by the current government to ensure that there are improvements in the health indicators. And for you to be able to take right decisions at the right time, you need to have tools that will gather the relevant data on identified indicators that are useful in the health sector. As we speak now, there is a strategy called SWAP, which is like a 5-year strategy to ensure that the ministers deliver on the mandate to Mr. President. There are a lot of gains of the NHMIS. One, it gives you opportunity to have real-time data for decision making. There are various activities that are being carried out and various interventions by partners and by governments. If the leaders and the managers of the health system don't have the information to reflect on what has been happening, to be a challenge. So the NHMI is a system that is helping the country to ensure that it has relevant data to ensure that decisions are taken real time. For example, if there are outbreaks, you need to have surveillance data. If surveys are done, you need to have that so that even as a country we can report to ourselves and to the international community.
The tool review process is a process that is usually undertaken to harmonize all existing tools in the health sector. And the process is aimed at either including new data elements or indicators or expunging indicators and data elements that are redundant, that are not being reported upon. Essentially, that's why we are doing this. And then the goal is to have tools that will be able to collect and report health intervention holistically to the national reporting platform, which is the DHIS2 platform. The National Health Information System Policy recommends that this tool should be reviewed every 2 years. But there are also challenges to that, because 2 years we've come to notice that is too short a period to be reviewing the tools every 2 years. Because when you review the tools, you're also supposed to do pilot, and then you're also supposed to begin to train health workers on the use of those tools. So 2 years is becoming too short, and then when we revise the policy, we are including recommendations that can extend it to maybe 3 or 4 years.